Well, first of all, I really would like to thank the ITI lead team Brazil for inviting me here. I mean, I know how difficult it is to organize a congress like this in such an amazing location and in this uncertain time. So thanks a lot, Professor Ronaldo. Thanks a lot to the other members of the lead team, and thanks a lot to you all for being here today. Well, my presentation will focus on the soft tissue augmentation procedures, and we will see different choices for different materials, and we will see first why we need to have a proper amount of keratinized mucosa around dental implants. Well, well, okay. I am an ITI member. I'm the ITI co-director of ITI Study Club Roma, so it's really a big honor and a big responsibility for me to be here on the stage today because I know how hard it is and the amount of work that is behind this Congress. Well, before we start, we should ask ourselves, do we need keratinized mucosa around dental implants? Well, if you take a look and you see the screen, you will see that we have two completely different scenarios. We have an implant which is well integrated with the tissues, and we have an implant who has a recession, who has a very thin band of keratinized mucosa. So obviously, from a clinical point of view, I don't think that we need to really think a lot about which is the best situation, because we know as clinicians that this is what we need. We need a proper transmucosal tunnel. We need all the signs of peri-implant health, and we can see the blood vessels here. We can see tissue, an implant which is well integrated.